Welcome here in Brussels for the first driving innovation in health data and digital health to push European healthcare forward.
And our goal is really to support innovation in healthcare. Basically, we want to explore the latest European health data policies and regulatory frameworks, such as financial, technical, legal, strategic challenges in adopting digital health solutions in hospitals.
We need to speed up. We need to work together much more really. And that's not just the stakeholders in Flanders or Belgium, but also the others. What happened in Denmark that's working? What happened in the Netherlands that's working? Let's reuse that instead of all being on our islands.
No more meetings, no more complaining, we just start building. I was very naive in 2021 where I thought if I develop this AI model, everything will be fine. But by far the hardest part was this cloud infrastructure to just select the right data and get the data in order.
There's such a big potential. We all know, as physicians, I'm a physician, that we are flying blindly. There are so many data out and we are not taking care of the data. We are not taking them in consideration.
Bring together hospitals and startups with their needs.
The results of this workshop, we talked a lot about involving the healthcare professionals from the beginning to make everyone speak the same language.
We focused on the people. That was the first session. And the second session was more on the business and the business model.
Topics like data sharing, digital innovation. In the second group, we wanted to understand what we could do about it. So what are some enablers? What are some good practices? What would be some recommendations? Thinking always about the patient perspectives.
We were in the group of data quality. Feedback is the key thing. Keep the human in loop and keep using the monitoring tools to really validate everything to have what I call trust in these technologies.
Another subject that came back was what I call the regulatory lasagna. The hospitals can struggle with fragmented data regulations across member states, especially in relation to health data.
Europe has always built itself in time of crisis. It was right in 2008 with the financial crisis. It was right with the sanitary crisis. What couldn't be right now?
The objective of the second day was really to be able to put this community of healthcare providers in contact with SMEs, a little in the spirit of what the European project TEF-Health is, to accelerate solutions on AI and robotics to the European markets, because this is really about making connection today.
And welcome to a panel discussion to use of data and health in Europe. How do you see the balance between what we are as Europeans and how we can achieve an economic happening?
It's a mix of legislation, of culture, and also of making sure the balance between risk and benefit is kept nice.
Another way to consider data, considering data as a world heritage, as a patrimonium, just like the cultural heritage that we all share. There's no right on it.
Your DNA sequence and genetic data, it's not only your data, but also your children's data.
Making sure data is only available in secure places in an anonymized format.
I think there's different ways in which we can collaborate in sharing information or capabilities.
I know it's scary, but I don't think society will benefit if we just sit on our data and say no to every company and protect our data. So please be open to sharing, to collaborating, and it will lead to some tricky situations that you have to work with your ethical and your legal teams, but that's worth it. I think we have a responsibility to use the data for the best purposes possible. Thank you so much.